Welcome to National Kidney Foundation National Spring Clinical Meetings 2013. I'm Ken Archibary from eAJKD, the official blog of American Journal of Kidney Diseases. We're here today with Dr. Ritu Soni from University of Pittsburgh, presenting her data on smartphone use in nephrology. She's from University of Pittsburgh. She's a second-year fellow. Welcome. Can you tell us a little bit about your work you presented today at the poster?
Sure. So as we all know that the smartphone has revolutionized not only how we communicate, but also how we practice medicine and impart medical education. And I think that this is the future of medicine. And it's estimated that more than 75% of healthcare providers use the smartphone or related applications in their day-to-day clinical practice. That being said, there is only limited evidence to support the usage and limited evidence in the smartphone usage in medicine, particularly nephrology. So what we try to do is we try to explore the smartphone usage in the nephrology division at PMC and identify the trends of usage, and also to identify if there was any need for more applications that they would like to have in the future.
And what did your results show?
So we conducted an internet-based survey and distributed among the division fellows, attendings, and the mid-level practitioners as well. We had a good response rate, about 78%, with a 100% response rate from the fellows and the mid-level practitioners. And the results were interesting. We found that more than 55% of the respondents used some kind of digital application in their clinical practice, either sometimes or very frequently. And interestingly, about 4 people or 11% did not have a smartphone, so they did not use the applications. Additionally, we also tried to delineate what kind of applications they used more often, and the most popular applications were medical calculators, with the reported usage being 63%. And the second most common were medical reference databases, for example, Medscape or Hippocrates or drug databases. And these were more pertaining to just general medicine. We did not further categorize whether these were nephrology-specific applications, and there wasn't any. We didn't have a free response section where they could mention what exact application they used more often.
For the future, what would you want? What type of applications would you want to be seen in the field of nephrology, and what did the fellows and attendants want?
So we also had that in the questionnaire, and we asked them that if they had an application on their mobile device that could walk them through a clinical problem, what would that be? And interestingly, the most requested application was on sodium and water metabolism, with 58% respondents requesting that topic. The second most commonly requested topic was disorders of calcium, magnesium, and phosphorus metabolism, with the response rate being 54%. And secondary hypertension and acid-base disorders were requested by 42% or so.
Well, thank you for your time, and thank you for joining us at NKF Spring Clinical Meetings 2013.
Thank you for having me.